Yeah, that's good. They, you know, what led me to this topic was that S.P. Balasubramanian, the singer, he died.
Mm.
And I was following his
Yes.
case very closely because I enjoy
Mm.
his
Yeah.
uh, his thing. I know most
Music.
of his life, and then so I was kind of feeling bad that but I know I told Dharani a long time ago, it's very unlikely he will survive because you cannot be on a ventilator for so long, you know.
Mm.
And one thing leads to other. I think they were thinking maybe he threw a clot from his legs and then he died of pulmonary embolism.
Okay.
So
Yeah, he
that
had multiple issues at that.
multiple issues, but that's why I wanted to talk to you how this is relevant is a lot of people don't realize that they are not well inside, you know.
Mm.
So the vitality is not there in these elderly people. They are just surviving because they are doing minimal work, they are getting medications, and they are not exposed to any stress in the nursing homes and people like SP Balasubramanian and all that. But when they are
Mm.
presented with a virus like this or even influenza, they usually respond in a negative way and then they die. Even with the influenza, people in nursing home die here because they're basically surviving on medications, nothing else, So that's why I wanted to bring that into fore and how we can connect it to what we should do to keep the vitality in the long run, you know. So I was going to uh, show you this. Uh, so regarding still, okay, share screen, share. Can you see the screen?
Mm.
Okay, it's still recording. Okay, so what I wanted to look at is what happened with that singer and also how that could be going on in us even now. Okay, and then you can feel that because we are running because of the work, we'll be running because our mind is doing all that, but they don't realize what's going on within them. Okay, so normally what happens is whenever a bug comes in, the bug induces some inflammation in the body because the body produces the inflammation to fight the bug. Okay, like some heat or the pain, the redness, swelling, all these are inflammatory signs. But within the body, there are some inflammatory markers that we can measure. And these are in the acute episode, they are good because they're attacking the enemy that is coming to the body and the body responding to kill that enemy. But then once that acute episode is gone, all that inflammation is going down, then you are fine. But in chronic inflammation where you are having so much of uh, this inflammatory cascade is going on for minor in assaults on the body that we don't pay attention to, they become, even the chronic stress induces this inflammatory cascade, and that becomes a problem down the line. So this is a good slide. I thought it was a nice one to look at because you want to solve the problem or leave the problem, but don't live with the problem. So the problem is chronic inflammation, and then with that, what is called cytokine storm that happens when the virus is exposed. Okay, so that cytokine storm is the inflammatory response that happened with this um, COVID virus, and that storm is so bad it went and destroyed other organs, the kidney, the brain, the heart, the intestine, so many places. So, and also it threw some clots to probably Balasubramanian must have died because he has been lying in the bed for a long time, and his legs threw a clot from there into his lung, and that clot killed him. That's one theory they were saying. But basically, he was obese, he had diabetes mellitus, and he was an ex-smoker. And he was always going. You know, he was like a type A person, not always on the go. You know, he missed his childhood of his children, and he was working very late hours and all that. So all that produces this inflammation. See, normally this slide, initially the viral response will have early infection, and later on it goes to the pulmonary phase. This particular virus clings to the lung, and it has a pulmonary phase in 2 phases, and then after that is recovered, this goes into a host inflammatory response phase. That is where, if you are not maintaining your inner vitality very well, that inflammatory response generated by you can kill you. That results in acute respiratory distress syndrome, the shock and cardiac failure and all that. There, we can measure them by measuring the inflammatory markers. You know, at that time, they try to do some things with the patient, but not all people are responding. Like, for example, he used a kind of external lungs, and then that's a very expensive. I believe there are only 1,000, extra corporeal lung function. Like they breathe for him. They take the carbon dioxide and give him oxygen and all that. So he survived for a while, but then that's very expensive, and then it doesn't really work. 2 out of 100 only survive, and those rest of them will die. And also ventilator, if you are there on so long, it is very difficult to get them off because the obesity, they don't have the respiratory muscles and all that, you know. So I had a very really skeptical look whether he will survive. But when they said he was making progress, I was happy. But then he suddenly died because of this clot, I believe, you know. That is very common in people who lie down in the hospital for a long time, either of the surgery or the stroke or all those things. So there is what is called sukshma yoga, micro yoga, that we can do even while lying down in the hospital, you know. And that sukshma yoga is moving his toes, moving your ankles, and then moving your calf muscles. All those things you can do on your own, and that will really encourage you to increase the circulation, because the muscles have to pump the veins. That we can do, you know. That's something with yoga. In there, what happens is, there are some genetic differences too. Usually what happens is, when the virus goes into the body, it tries to invade a cell and then make itself millions of copies, and that replication rate can be genetic influence, or in inducing the immune response in the form of T cells or cytotoxic T cells. That also can be a genetic factor. But if you have more T cells, the virus will be killed, like in this diagram, you know. I'm just being very layman terms, because most of the people will be listening will be layman too, you know. But doctors always know. And this is about what's called surfactant, which keeps the alveoli, the respiratory unit in the lung, keeps it open, you know. That gets damaged too. That's why you see in this other slide, on the right side, you can see on the bottom of the lung how much inflammation accumulates. This is what happened to him. He had a pneumonia-like consolidation, where something like cotton lung has become very solid, and that's why he could not exchange the gases, you know. All that happens because your own inflammation also doesn't help you to really recover from the attack, you know. And later on, the cytokine storm is the responsible for severe illness in healthy patients. Patients who are healthy, otherwise they suddenly got it, and then their body's underlying response is not good. That's where I'm going to focus on what you can do daily to help your vitality within. It's not enough if you just walk or if you just do a few active exercises and all. You have to have a plan for this. That's what I'm going to discuss in this one. Okay. Always you start the day with the Surya Namaskars. That is the one which is a aerobic exercise, but at the same time you don't have to jump up and down. A lot of people with arthritis, pain in the joints, in the knees, they cannot really run, they cannot really do that. But then if you run at a good pace for about 20 minutes, you can flush all your organs. But in Surya Namaskars, you can do them 2 or 3 people will have that kind of effect, but it has to be done properly though, But if you start the Surya Namaskars, I would recommend to go at least 8 times in the morning. You can start with 1, 2 and stay there. And as you improve your capacity, you can increase up to at least 8. You can do them 8 in about 5 minutes, and then you can always breathe in a proper way in Surya Namaskars. And also you have to align with both left side and right side. And also keep the mind in the present. These 3 principles are good for any of the other things we are talking about. Being in the present, aligning both sides, and coordinating with the breath. Okay. Then you go into vinyasa, where you do these yogasanas as per your capacity, your state of body, your age, your diseases, your problems of pains or aches in the body and all that. So this can be universal for everybody. What is universal is that you can do very vigorous yogic practice where body will get real good exercise, So you can devise this according to your knowledge of the body, and then you can improve it. Suppose you have a body backache, you may not be able to do certain things. So first you have to repair that backache. So you have to do exercises that are good for you, for your back. After that is corrected, then you can go to other things. For example, if you are elderly, you get up in the morning, you have a lot of aches and pains in the joints. First, you have to do simple things to get the aches in the joints go away, and then go into the vinyasa. So there are so many precautions you have to take. But once you found your rhythm, and I have so many routines that I could tell people that are appropriate for them. So yoga practice has to be individualized, but at the same time, you can build them up, And then after you have done the Surya Namaskaras and Vinyasa, only then do the real regular pranayama, because all the collateral or potential vessels open up with exercise because you place some demands on them. So the muscles want more oxygen and their blood vessels are open up. So when you do the pranayama, more of those muscles will get the oxygen that are remote. This is why you don't get that much cramps when you do yoga with pranayama. Whereas if you run without really attending to your breathing, you will end up having cramps, especially in hot atmosphere where you are not having much water and much of the salts and all that, okay? And then once you have really exercised, really done very well with the breathing, then you lie down. This is a must for any yoga session. You have to do this because you have to relax from head to toe. You have to kind of suspend the body and suspend the mind and be in the present. This is done now because all the running, everything you do will activate your sympathetic nervous system, which is go, fight or flight, the hormones that are secreted, they are all very stressful hormones too, if they are not opposed with the opposite group of parasympathetic nervous system. So in this calf pose, what you do is you deliberately relax everything within you, and the tension, the stress, and everything will be relaxed, So your whole system will come to what is called ease. If you don't have the ease, that is the disease. So the ease is the normal function of the body, but we kind of, with our thoughts, with our drives, with our ambitions and all that, we drive the body to a state where it has to run, run, run. You got to take a deliberate break from that. That's why this carb source is so critical, and this developing very good inflammatory cascade, not to have such a major inflammatory episode where that is attacking our organs. So this is why I'm insisting on proper practice of yoga. Is you can start with something aerobic like Surya Namaskars, and then you can do yoga vinyasa, and then you can do breathing, and then you relax the entire session with this calf pose. And then you can sit down and calm your mind too, if you have not already done in the calf pose. In the meditation, you just repeat one thing and try to concentrate on one thing. People can do it with prayer or mantra or one word or anything like that. Okay, I'm not going the details of all that, because body is an outer covering of the mind, and whatever the mind will dictate to it, it will have to carry out. So if you can manage the mind all the time, not only when you want to, but also in situations where you are running, you are reacting, you are anxious and all that, that is when you have to remember not to be so reactive during the day, But that is more important than just having the body that is really, good shape, So that's why I put this slide, Of course, this is the namaste we always say, soul to soul, honor the place in you where the entire universe resides. That's the main point. I honor the light, love, truth, beauty, and peace within you, because it is also within me. So you have to have the sensation and then really do that. See, I was telling my sister to advise somebody who has a kid, that kid, even though grown up, the mother has to do everything for her because she is kind of demented. But then if that mother can see this in that kid, she will be able to perform all the services that she is doing for the kid with much more meaning, So this is useful in so many situations, So this is what it is. That's all I wanted to bring to everybody's notice, how we can use this experience, to see how yoga can help us for long-term vitality. Okay?
Yes, yes, Chinbabu.
Yeah.
I do Surya Namaskara 11, and then I do Upayoga and Shambhavi, but I don't do that corpse pose. I finish it and I go up. I think I should do that relaxation. I must do.
That's very important, because once you start to learn how to relax in the morning, that relaxation helps you not only that time, but also later on. So,
we do it twice during the session for us.
That's good. So, no, whatever it is, it has to be part of our routine.
Good, yeah.
And then there are extensions in this. Shavasana, there are 3 levels you can do. Minimum, moderate, and then maximum, all those things. So first one will be 5 minutes, second one will be 10 minutes, third one is 25 minutes, So how much you can stay on. And when you are doing it, you need to see whether you are having more like more like people are, uh, I mean, basically, you got to go by your understanding, by your capacity, what you can do, you know. But most of the time, people do them very briefly and then go. You won't get the entire suspension because your heart rate has to go down, your breathing has to be steady, your thought has to be stilled, and then you kind of aware of the surroundings, the time, and also you can really be in that energy where it is silent and nurturing. You know, people always say like, oh, I have this much time, I'm going to do this and go. That doesn't work. Okay. The depth of the relaxation such a way, even if you do few minutes, it will be very good. You know, even if you do few minutes, you know, it will be very good. You know, people have to do that. You know, Surya Namaskars, when you do them, with each one, you can be focused. First of all, you indicate that you are really paying respect to the sun, who is the giver of life. Then you kind of go initiate the breathing, and then you kind of bend down as though you are really bending to the higher power, and then you go to the routine with when you are bending backwards, you are taking the deep breath inside, and when you're bending forward, you are blowing the air out. All those things, they are done with alignment, with presence, and with breathing coordination. You'll get the maximum benefit. Even if you go 12, 11 is pretty good, Sunandu. You know?
Yeah, I used to do I think I used to do 100 and all, but now I'm 11 with yeah, 11 I'm doing.
If we do them, pretty good, you know. If we don't do them, I mean, lots of people do only couple of them, but even couple of them, if they are done with all the presence, with all kind of breathing coordination and sides coordination, you will get the most out of it. Like that, if you go to Vinyasa, you can do 12 asana routine, or head to toe routine, or there are Rakolich routines, and then there's so many routines that you can adopt for yourself. But then there I would suggest what is called Swadhyaya. Okay, that Swadhyaya is something is very, very good, because it gives you knowledge of your own body, where you are at. Is that then if you do more, you can get hurt. Okay, so that's why you have to employ that Swadhyaya, where you are aware of your body and you are getting familiar with it, and then you can adjust the yoga according to that. In each yoga, so there is again a base, intermediate step, and advanced step. So you can take yourself from the base for a while, and then it will automatically allow you to go to the next step. If you force it, then you can get injured. That's where the guidance from a experienced teacher is very important, because he has to work with your body, not with what is ideal. You know, the ideal is going to take you there, but your body has to allow it. Otherwise, you can get hurt. You know, in the pranayama, again, at least few of them are very important. Kapalabhati, Anulom Vilom. You know, those two you have to do 15 minutes each every day. And then you will get the benefit that I'm talking about. You know, then meditation is something that everybody knows how much they should do or what type they should do. It's all very personal thing, but basically you can start with breathing, you can start with staring at a light, or you can start with Gayatri mantra or something like that. All those things are kind of quietens the mind and concentrate the mind. But after concentration, there's much more. You can't even go there unless you do the basic. You know. Any questions? Anybody else? Chichu?
చిచ్చు చిచ్చు ఉన్నావా?
ఏదో మాట్లాడుతుంది కానీ వినపడటం లేదు.
She has to unmute.
No, we can't hear you, Chichu. We can't hear you.
I unmuted myself.
Yeah. Now we can.
Now we can hear.
Yeah. Oh, okay. Yeah, I'm doing yoga. The day I don't do, there have been some times when I do miss it. And it really causes me terrible discomfort the whole day. I start imagining cough and all that stuff also. So I ensure I try not to miss it. But yeah, it's just that if we get up early in the morning, that's the only push for us. Otherwise, once we are up, we are doing it. So in that we do, memo 8 times chestamu, Surya Namaskara.
Yeah, that's good.
Sometimes if I'm not doing with them, I do it 12 times. But in the group, we do it 8 times. And then we after the Surya Namaskara, we just do the Shavasana. We don't call it as a Shavasana because as per the procedure, they shouldn't call it. It's just a brief rest. Tarvata mala mid section ainaka, we do that time we do a proper Shavasana. And then we do the pranayama. So we do 3 Kapalbhati off late. We're doing Kapalbhati and Agnisar a lot. 6 minutes or 5 minutes or 3 minutes depending. Anulom vilom కూడా చేస్తాము, బట్ మేము రోజు మార్చాలని చూస్తుంటాం కదా, రోజు ఒక్కొక్కటి లాగా అట్లా. సో
you have to allow both.
అగ్నిసార్ కాంబినేషన్ ఉంటుంది, కపాల్భాతి అగ్నిసార్ కాంబినేషన్ లో ఉంటుంది. అనులోమ్ విలోమ్ అని ఉంటుంది, లేకపోతే నాడీ శోధన అని ఉంది, లేకపోతే భ్రామరి చేస్తారు అట్లా.
Brahmari is very good. Say actually Kapalbhati, Anulom Vilom, Brahmari, these are must. You should not miss them.
So must కాబట్టి
అది రోజు మార్చి రోజు కాదు, రోజు చేయాలి అవి. రోజు చేస్తే మంచిది.
యా, నేను నా సెషన్ లో చేసేది నేను చెప్తున్నా. దిస్ ఇస్ వాట్ వి డు. అండ్
ఆ తర్వాత నువ్వు చేసుకో, అవి చేసి కంప్లీట్ చేయి.